In the last week of December 2018, Benson and Sheila were thrilled to have an addition to their family. And 6 weeks later, the enthusiastic couple checked in at the Kisumu Referral Hospital at 9 a.m. Early enough, they thought, for their son to receive the routine 6th-week vaccine.
Nilikaa pale mpaka ikafika saa 10 sijahudumiwa.
They left the hospital, pondering over their next move to ensure their child gets the requisite dose of BCG. Benson is a casual laborer while Sheila vends vegetables at the Kondele market. The money they make per day caters for rent, food and education for their 3 other children. They barely have enough to spare to afford health services at a private facility.
Lazima tu wa survive na hizo chanjos. Na usipopewa hakuna vile unaweza kuwa. Sasa mimi roho yangu inasononeka sana.
In August last year, Benson enrolled himself and his family to the Universal Health Coverage Program that would allow them to get free medical services. And even though routine vaccinations for infants are offered free of charge in public hospitals, he had high hopes in the system.
Tulikuwa tunaenda tu hapo na tushughulikia tu free of charge. That is, nilikuwa najua tu this time round pia watatushughulikia hivyo.
Despite threats by the Kisumu County government, the nurses remain on strike. The effects of the withdrawal of services are being felt.
Bado nitarudi tu Russia kesho asubuhi, niende nijaribu, nione kama naweza hudumiwa. Sisi ndio tunateseka. Sisi ndio tunateseka kabisa.
Laura Otieno, Citizen TV, Kisumu. Well, basically that is what is happening here in Kisumu County, and the governor had on Friday indicated that he had given the nurses a 3-hour ultimatum to report to work. Well, failure to that, we saw a ripple effect of that, where on Saturday he advertised positions to hire nurses temporarily. Now today we have been doing spot checks around public hospitals, and no nurses so far have been taken in to fill the gap left by some 800 nurses who still insist that until their allowances are remitted, then they will not be reporting to work. Well, the Kisumu County government had earlier on indicated that they have 34 million shillings for the payment of the nurses, but then they say that they are following the directive of the Council of Governors and they will not be paying that money to the nurses, because that will be committing an illegality and it is an unconstitutional move. So of course all eyes will now move to the nurses to see whether they will budge and go back to hospital now that the county government has made clear its stance that it will not be paying a single shilling to the striking nurses.